Kansas to date has chosen not to accept that part of the program. And so as a result, we have about 150,000 people who are in what we call a coverage gap. They make too much money to be eligible for our current KanCare program, but not enough to be eligible to get tax credits and subsidies to buy private insurance. For them, there are currently just no options for health insurance. And so we really need to accept the expansion of KanCare to allow these people to be covered. These are largely low-income working people. So more than 3/4 of them either are working or are in families where a member of the family is working. They are the working poor, essentially. They work in jobs that don't offer them health insurance, or if they do get an offer, it's unaffordable to them. And those are the people who are missing out on the benefits of this program. Where the rubber hits the road on everything in health and health policy and health care is how much it all costs. And what we've seen in the last several years is the slowest rate of cost growth that we've ever had. And so we've been measuring the rate of growth in healthcare costs for 50 years, and we have never seen costs grow as slowly as they are growing today. It will not. Expansion is part of the Affordable Care Act, which is fully funded and fully paid for. It will actually reduce the deficit and the debt. But the bottom line is that this is a statute. This is federal law. There's not some bureaucrat sitting in Washington who can decide this year we're not going to pay. The law says the federal government will pay, and until the law is changed, the federal government will pay. That's how it works. The hospital in Independence, Kansas recently closed. And a lot of issues led to that closure. But a big part of it was the fact that the state hasn't expanded Medicaid. And so in the case of that hospital, they're seeing about $1 million less from the Medicare program than they would have otherwise expected. But they would gain $1.5 million a year by having more people covered by Medicaid if we expanded that program. Kansas is benefiting primarily by having thousands and thousands of people who have insurance coverage today who did not have it before the Affordable Care Act. So the best data we have is about a year old. It's from the census, which is the gold standard for data. And we know that there are 57,000 fewer uninsured folks in Kansas in 2014 than there were in 2013. We can't lose sight of the fact what we're really talking about is people. And this program will give health coverage to 150,000 people that don't have it today. And Kansans that don't have coverage today need that, and we should all be concerned with the fact that they should be able to get to the hospital and the doctor when they need it.